Yeah, I think you're kind of nervous, right?
A little bit,
Okay.
yeah.
Angie Henry is checking in for surgery that'll rid her of the glasses she's been wearing since 4th grade.
Bottoms up.
Henry takes the prescribed Valium and waits for her nerves to settle.
I guess it's more of how is it all going to go, and afterwards, you know, how is my vision going to be when I leave here?
She'll find out sooner than she thinks. Angie's first led back to a prep room.
Keep your eyes closed while I do this, because this stuff will sting if you open them, okay?
Once her eye area is disinfected, Henry enters the operating room to meet Dr. William Wiley.
So just real quick, I'm just curious, can you see the clock on the wall? Can you see what time it is by any chance without squinting?
Oh, no, I can't. No.
No problem. With Henry in position, Dr. Wiley pops in a couple numbing drops and gets to work on her right eye.
Now you're going to feel some pressure here, okay? That's probably the worst part of the whole procedure is that suction device, okay? What we do is create a flap in the front part of the eye that's called the cornea.
After the flap is cut in Angie's other eye as well, Dr. Wiley begins correcting her sight.
Once we create the flap, we lift the flap and expose the center part of the cornea.
Angie's eye is lined up with the laser, and the work begins.
The laser's tracked onto your iris here. It's all lined up. Perfect, keep it. Excellent. Perfect. We use a laser to reshape that part of the cornea. So more or less what we're doing is imprinting the contact lens prescription onto the cornea.
That prescription was mapped out with extreme precision days before surgery with this computer, and then transferred directly into the intralaser machine. The laser is done in 30 seconds.
Going to reposition your flap. Then we put the flap down, smooth the flap out, and then the flap just has to heal right around the edge.
The procedure is repeated on Angie's other eye, and after a total of about 15 minutes, Angie is sitting up and checking out that wall clock again.
I don't know if you can see it or not. Can you tell us what time it is?
6:35.
Yeah, that's right. That's right. Congratulations. You did fantastic. Went very smooth. You're welcome.
I didn't feel anything. I could just hear it, and it was kind of moving around, and it was over. I mean, it was not bad at all.
After a few last-minute instructions, Angie and her husband go home. Dr. Wiley says the average patient spends between $1,000 and $2,000 to have LASIK done on each eye, and pretty much anyone can have it done as long as you have a stable prescription and corneas that are thick enough to withstand the laser. And once you have LASIK, your sight is set for life.
The only glasses I'll need from now on are sunglasses.
Sashem, Brey, 13 ABC Action News.